So we've developed a network called Men of African Descent and Carcinoma of the Prostate, or the MADCaP Network. It's a consortium of about a dozen centers in Sub-Saharan Africa and about a dozen in North America. And the goal is to bring together researchers who are asking common questions about prostate cancer etiology, treatment, prevention, screening, and to learn from each other. So that we can elevate the quality of the research and the impact on African populations. So the network has been very active in creating guidelines, protocols, and best practices for doing research. So we've created databases and surveys and all kinds of resources for laboratory studies, for biosample collection, storage, and processing, etc. So we have a baseline set of resources that can be used across Africa to promote cancer research, and particularly prostate cancer research. But beyond that, we've spent time studying the genomics of prostate cancer. Prostate cancer is elevated in incidence and mortality among African descent men. And we don't really yet know why that is. In part, we can learn from the entire spectrum of the African diaspora in North America, in Africa, to understand any underlying biological components to that elevated risk. The MADCaP network has begun to characterize common genomic factors that are associated with prostate cancer in African descent populations. We know that prostate cancer is one of the most heritable of all cancers, and yet we have very few modifiable risk factors for prostate cancer. So it's become really important for us to understand what that underlying genomic pattern might be, the genetic architecture of prostate cancer. So the MADCaP network has begun to do this by undertaking genome-wide association studies, other kinds of expression analyses in prostate tumors, and we've begun to characterize both the inherited and the somatic germline, somatic genome of prostate tumors, and we've begun to see some interesting patterns, some of which are very common to what we've seen in non-African populations, and some that are very different. And we've begun to see some evolutionary population genetics patterns that might begin to help us explain the high rates of prostate cancer in African descent men. It's very important that when we make discoveries about genetics and genomics in a population, and in populations like Africa, that we then translate that into something that can be used clinically to reduce risk, to act on prevention and treatment. And so we've begun to do that by creating a couple of feasibility pilot studies where we are doing genetic testing for high penetrance, high risk alleles. So we've begun to do this by a study of 400 prostate cancer cases and some breast cancer cases in Rwanda, to see whether we can develop protocols and practices that can be used to implement genetic testing in an African setting. And this is not only important because we can learn a lot from the African setting in terms of diversity in genetics and things like that, but we really feel it's important for the African populations to have access to the latest state-of-the-art treatment, prevention practices that are out there. And this is difficult because there are a lot of needs in Africa, but if we don't start working on advanced practice approaches, genetics and genomics approaches, precision approaches, then Africans won't have access to these tools. And it's really important that we start to develop those and figure out how they can be implemented in a low resource setting.